A wasted hour doesn't mean a wasted day. A wasted day doesn't translate to a wasted week. Though I'm a dermatology resident, there was a brief moment where I wanted to take up surgery. The man, the myth, the legend, he needs no introduction. So I want to become a teacher myself. So he covered it from A to Z. Like every bit of surgery was covered. We are the ones who had our NEET PG being postponed, every month. So it breaks the monotony. It gives you a schedule towards the end. Hi, I'm Dr. Raj. I'm currently a first year junior resident in Bangalore Medical College, and I've secured a rank of 57 in NEET PG 2024. I'm here to tell you about the three important things that determine your rank, like the three basic principles that you'll have to incorporate into your preparation. First one would be is completing the syllabus on time. That is completing your first, second, and third read. So I would recommend 3 readings before your final revision. The most important thing is that you complete these 3 readings at that stipulated time as per your schedule permits you. So if you're doing it during your internship or post-internship, give it maybe 5 months for the first read, 3 months for the second read, and maybe 2 months for the last read. This first, second, and third read in that stipulated period should go simultaneously with your previous year questions, which will give you an idea of what you're going to be asked during your exam. So coming to the first principle that I talked about completing a syllabus on time, completing those 3 readings on time. So you'll have to plan it in such a way depending on which stage of your MBBS journey you're in. So let's say if you're in your internship, so you'll have to plan it in such a way that, you finish your first readings during a hectic postings, or maybe you give an adequate amount of time. So give a decent amount of time for your first reading and then maybe cut short the second and third reading. As a general rule of thumb, you can maybe give 6 months for your first read and then 3 months for your second read, maybe 2 months for your last read. Okay, or maybe make the first reading 5. So finish the whole thing in 10 months. Make sure that you've done your part. So there might be times where you'll probably have a bad week or even let's say a bad fortnight. But that doesn't mean that you give up on that schedule. Make sure that you somehow make it up and then finish that particular subject within that stipulated time so that, you're not cramped towards the end. And one more thing that I've noticed is a lot of us, including me, like if a certain day doesn't go right, I tend to waste that entire week. Like a wasted hour doesn't mean a wasted day. A wasted day doesn't translate to a wasted week. So just give it your best and then you'll eventually come back sticking to your schedule, but just don't give up on it. Stick to it. So one way you can overcome this problem of, creating the schedule and sticking to your timeline is by signing up to DBMCI's face-to-face or online classes where they will make the schedule for you. And, they ensure that the syllabus is completed on time. And then they also create these custom modules where, the previous year questions are incorporated. So by doing this, you ensure that you complete your syllabus on time. And, they've been doing this for a long time. So they make sure that, you get adequate time for each subject. And, all the major subjects are given its due importance, like, a couple of weeks. And then the minor subjects are covered in a few days. So I think that's the right way to go. Like, especially if you're someone like me who can't do it and who's not that motivated, I think this is the best way, wherein like someone makes the schedule for you and ensure that, you follow it. Okay, now coming to incorporating your MCQs into your preparation. The first MCQs that you'll have to solve is the previous year questions. Okay, the previous year questions are the ones which will give you an idea of what is to expect in the actual exam. What does it mean to solve a question? Okay, so it's the best way to actively recall what you've studied. Pointlessly studying the same thing again and again over and over is not going to help much. You're definitely going to forget it. MCQs are the best way to actively recall what you've studied. After you get the right answer or the wrong answer, scroll down and see the explanation for it. So once you see the explanation and understand where you've gone wrong or understand what made you choose the right answer, make a mental note of what is present there. And if it's a column or a table related to that question that you're likely to forget, immediately make a note of it into your notes or like keep a separate notebook wherein you note that down. So this will debulk your, primary notes wherein it will make it smaller. The more important ones, the more high yield ones which have been asked in the previous years will now form the base for your next revision. So this is the method by which you use PYQs and incorporate it into your reading and make your, initial notes smaller and smaller as you read. The way I solved my previous year questions is by creating custom modules in the Marrow app. So the custom module feature is a really, user-friendly, intuitive feature wherein it gives you those tags wherein you can choose recent NEET and, aims, wherein it will give you the questions of past NEET and aims from, I think, 2017. And that's plenty. That's more than enough. So after you finish a topic, choose that topic in the custom module and choose these two hashtags and you're good to go. You have a perfect custom module of all the previous year questions that you need to solve, and then you can knock off that topic from your list. This is how you finish your topic, by reading it and then immediately going ahead and creating those custom modules and solving your previous year questions, and if possible even as many Q bank questions as you can. That's only after you've done the previous year questions. So focus on the previous year questions and the Q bank if possible. Even this has been taken off your hands now, wherein the DBMCI faculty themselves are creating the Marrow custom modules for you, and you'll just have to solve it right after the class gets over. So this in turn will ensure that you're attending your classes, finishing that subject, and then also solving the previous year questions and Q bank of that topic. Okay, now coming to how test and discussion helped me. So, we were the 2024 NEET PG batch. So, we are the ones who had our NEET PG being postponed, every month. During that period, what happened was it became quite monotonous to study the same thing again and again, and then, solve questions, study, solve questions. It's very refreshing to see your faculty again, hearing from them and then, learning from them, at least even for that few hours, actually does make a difference. They would give you those small tips like, that you tend to miss, and then they'll also curate questions for you. And this is something that towards the last, it actually, gives you that last push wherein, they're guiding you. So it breaks the monotony. It gives you a schedule towards the end, gives you that fine tips that you might have missed. Entire 10 months now culminates in these last 20 days, and this determines your rank. The effort that you put in by concising your notes will eventually lead to your 20th notebook. The basic principle is you read your 20th notebook as many times as you can during your last 20 days. Even during those days, if there's something that you're sure that you'll remember, knock it off your 20th notebook. Make it into a smaller notebook and keep revising it again and again. So that should be your principle for the last 20 days. Coming to the number of GTs to give and the frequency at which you should give it and the way you should give your GTs. Initially, during your first read, obviously you wouldn't have covered all the subjects that there is. So it doesn't make sense to give GTs that frequently. So maybe give it every month, like at least in the first 5 months, wherein at least you're giving 5 GTs by the time you're done reading it once. Okay, so now when you move on to your second read, make it every fortnight. Okay, at least every 2 weeks. 2 to 3 weeks if possible. Moving on to your third revision, wherein you've done everything twice, now it has to be at least every 10 days. So make sure that you're giving a GT every 10 days. And then during your last 20 days, make sure you're giving a GT every 3 days. Just a week before the exam, stop giving GTs. Like, you don't want your morale to go low if, that particular GT doesn't go your way. So after giving a GT, how does one analyze it? Don't worry about the right questions now. You don't have time to sit and analyze 200 questions. It's going to eat up at least 2 to 3 days of your time. Look at the wrong questions and see what the examiner is expecting. Like, see where the question is guiding you, and improve your question solving ability. Use your GTs as a learning tool, like not a testing tool. GTs is a way to test your question solving ability. The only thing that you should be taking away from a GT is how you discern what the examiner is trying to ask of you. And that is what you learn from a GT. You'll have to go back and see where you're going wrong. Like, the reason your GT scores are stuck is probably because you're not efficiently using the GTs. Maybe you've not learned from your previous GT. So just go back to your previous GT and see where you've gone wrong. A recall error, you're making more of recall errors. Go back to your notes and then like do it again. Or if it's, your ability to solve questions, maybe you're zoning out on those long questions. Go and solve those type of questions. Like, that's again where your custom modules come into play, wherein it has those hashtag clinical. You can choose those tags and do those type of questions again. And if there's a particular topic that you're weak at, like maybe, your aggregate is much lesser compared to your peers, go and work on that topic. So use the GT effectively, and there is no question of it, being stagnant. And sometimes it so happens that the next GT can be a little tougher than the previous one. Don't dwell on it too much, just go and try to learn from the previous GT rather than, like I said, seeing where your score is or seeing where you stand in comparison to your peers. That doesn't make sense. That defeats the purpose of giving a GT. So don't get disheartened by, a stuck GT score. Like there should be no such thing. If you're utilizing it properly. So just ensure that you, correct these mistakes, and I'm sure the GT scores will pick up. Break to go use the washroom. So these are concerns that you actually have to address. This might seem something that's very trivial. So by solving a GT, sitting in a place for 3 hours, simulating the environment of an exam, so that's when you learn how to solve 200 questions sitting in one place. And then again, your ability to solve questions improves, though your knowledge might not improve, like, by analyzing the questions, your ability to solve the question, to understand what the examiner expects of you. Try to learn that from a GP instead of, trying to see where you stand in the state or trying to see where you stand in the country. That defeats the purpose of giving a GT, actually, if you ask me. My favorite faculty for the subject of medicine is obviously Dr. Thameem sir. He's the man, the myth, the legend. He needs no introduction. So he's the reason why my medicine, and in turn my pathology and my pharmacology as a benefit, was so strong. Every word coming out of his mouth has some weightage. Everything he says, he correlates it with some study. He gives you proof for everything he says. So he can't be disputed. Puts forward an information in such a way that it's very concise, very crisp, which you can immediately recall. It's not all over the place. It's very to the point. And he's someone who's a very serious person, and he believes in that. And I truly believe in that style of teaching. So I want to become a teacher myself, and hopefully, I can incorporate some part of what he's taught me into my life as well. So another favorite faculty of mine would be Dr. Jai Arora sir, because though I'm a dermatology resident, there was a brief moment where I wanted to take up surgery, and all the credit goes to sir, because he used to teach surgery in such a expansive, holistic way, from the basics to, like, the complex procedures that you would probably not even expect first year residents to know. So he covered it from A to Z, like every bit of surgery was covered in his own characteristic, Jai Arora sir kind of way. And that is something that really inspires you to study that subject. So yeah, he's the reason that, all of us at some point of our lives would want to take up surgery during his classes. So don't get disheartened by, a stuck GT score. Don't dwell on it too much. Just give it your best, and then you'll eventually come back. Don't give up on it.